the news of COVID broke, right? Almost a year ago now. Where were you sitting? What did you think? What were your thoughts?
So when it was sort of breaking out in China, I'm like, this is not going to be contained. It's going to
Immediately
get
you
out.
knew that this was going to go
Yeah,
downhill. Oh my God.
yeah. With modern mobility and flights and
That's fair.
transport and airborne viruses, I think I mean, there's been a lot of near misses over the last
Yeah.
20 years. You
Sure.
know, H1N1 did kill quite a number of people.
Hmm.
And we knew a lot about this because part of the facilities that we designed in College Station were about being able to have fast response for vaccine manufacturing. So I think the primary thought there was that it was more than likely to be some sort of a pandemic flu virus,
Sure.
rather than this whole completely novel virus which came out. Same principles apply,
Yeah.
and the manufacturing platforms are very similar. So we had to set up to be able to handle a huge number of different methodologies and to very flexibly respond. So always in the back of our mind at the Fuji Diosynth Biotechnology, Texas, we wanted to be prepared and know, what we would do. So whenever we build up our infrastructure, our facility, our capacity, our platforms, equipment platforms, and procedures, we want to make sure that we're serving our commercial, clients, but also to be able to use our facilities in case of national need. So
Sure. So national needs upon you at this point, and you win the contract to manufacture the Novavax vaccine. What was your first step? What did you have to do from that point?
So there was a whole variety of things. So so the Fuji Diosynth Biotechnology is a multi-site, multinational subsidiary of the bigger, Fujifilm parent company. So we have sites in the UK, we have a site in Denmark, we have a site in Texas, we have a site in North Carolina. And so we're actually responding across our network. So it was really a whole thing. We had designed a large capital expansion plan, and we were starting to roll pieces of it out. So what we ended up doing was doing it all at once in parallel, basically at warp speed, really. Yeah, it's been a great challenge, a great experience, but we're actively manufacturing in facilities and equipment which did not exist in the end of last July.
Wow.
You can think about that. So we devised a method to construct in 3 different levels across our facility at the same time. So we chose a clean room technology that allowed us to work on ground level in an interstitial space and on a mechanical mezzanine simultaneously. We had the Army Corps of Engineers come in as an assistance from Operation Warp Speed to basically assess the methodologies. And they basically said that it was impossible to get any higher labor density in terms of construction than what we were doing.
Wow.
And we managed to do all of that well over 100,000 man hours with no accidents. So that's something
Nice.
we're really proud of.
Wow.
So yeah, so we looked at, so there were a number of vaccine technologies that were posed to us. We looked them for fit and deployment within the facility efficiency. We devised sort of an equipment and facility strategy to optimize the throughput for the particular vaccine. So they're the technology providers, and then we work very closely with them and different groups in the government, in particular BARDA and Operation Warp Speed, to get all this going. Well, and I should mention vendors and electrical contractors, mechanical construction contractors,
It's a
our
huge pile of
equipment
people
vendors,
all working together.
consumable vendors. It's a really complex undertaking, just physically to do it, but also to get alignment across all these different stakeholders. So, and then I must say the City of College Station, City of Bryan have been absolutely fantastic in supporting fast review of permits and so on. So it's really it's a demonstration of the can-do Texas attitude, I would say.